Hi everyone, welcome to researchmd.com. Our presentation today is about how to give first aid in a seizure episode. If you see someone having seizure, what is the primary things you have to do to help the person. Again, my name is Pramil. Cheriyath. I'm a program director, internal medicine residency program, transitional residency program. I teach medical students and residents, and I'm also director of research. So let's get into our topic. So what is epilepsy or seizure? It's a disorder of the brain that causes seizure, right? It's a sudden uncontrolled electrical disturbances in the brain, and it causes change in the behavior, movement, feeling, and level of consciousness. All of this can be affected. So the main purpose of this topic is like, if you're a bystander, what are the measures you can do to help the person, okay? Let's look at some of the general steps we have to do first, and then we're going to talk about the specifics. So what are the general steps? 1, stay with the person until the seizure ends and he or she is fully awake. After it ends, help the person, sit in a safe place. Once they are alert and able to communicate, tell them what happened in very simple terms, okay? Number 2, check and see if the person wearing a medical bracelet or their emergency information. That can tell you a lot of information. This person have epilepsy, any other medical disorder will tell you that. Keep yourself, otherwise, and the other people calm. It's very important to stay calm so our thinking kind of goes smooth. And offer to call an ambulance or transportation or another person to make sure the person get home safely also. So, first aid for generalized tonic-clonic seizures, okay? When most people think of seizure, they think generalized tonic-clonic seizures, also called grand mal seizures. In this type of seizure, the person may cry out, fall, shake, and jerk, or make them unaware of what's going on around them, okay? So we're pretty much talking, what do we do when we see somebody have this generalized tonic-clonic seizures? Now, some of the things we're going to go by step. A bystander can do. 1, ease the person to the floor. Number 2, turn the person gently to the one side. This helps the person breathe better. You mainly protecting the airway when you do that. Clear the area around the person of anything hard or sharp. This can prevent a serious injury to the person having seizure, right? Put something soft and flat, like a folded jacket, under his or her head, and remove his eyeglasses. And loosen ties or anything around the neck which can choke the patient, make it hard for him to breathe. And time the seizure. That's also very important. If the person is having seizure like more than 5 minutes, then you have to call 911. What are the steps you don't want to do which can hurt the patient? These are the things we mentioned. 1, do not hold the person down or try to stop his or her movement. Number 2, do not put anything in the person's mouth. This can injure the teeth or the jaw, and they can have a problem with the airways when you do that, okay? Do not try to give mouth-to-mouth breathing like CPR when a person is having seizure. And do not give the person water or food until he is fully alert. Very, very important. Otherwise, they can aspirate and die. So when is the best time to call 911? If a person is having a seizure, never had a seizure before, call 911 right away, okay? The patient is having difficulty breathing, airways compromised, and is now waking up the seizure, you should call them. If the seizure lasts more than 5 minutes, that's also a red flag, you need to call them. Let's say, if this person have a history of seizure and then he had the seizure more than 5 minutes, you should call them. The person have another seizure soon after the first one. The person having multiple seizures, that's an emergency also. And if a person get hurt during the seizure, and then you also need to call. If the seizure happened in the water, you have to call 911 right away. The person have another health condition like diabetes, heart disease, or especially pregnancy, call 911 right away. Okay, these are some of the measures as a bystander you can do to help the patients who's having seizure. Thank you so much for joining us. We'll be back with another presentation soon. Please subscribe to our channel. Thank you.